my student. The theme of today's lecture is so we start to learn the second chapter of the module of osteosyndesmology, which is called the bone articulation or syndesmology. And the part one, I give the explanation of joints and the type of joints, and also I give explanation in the first chapter of the lectures about the joint of the trunk and some joint of the upper limb. So the joint is a part of the support and locomotor apparatus. They retain bone to each other and provide their mobility during movement. At the first, the skeletal germs are connected to each other by the layer of mesenchyme. The mesenchyme transforms to connective or cartilaginous tissues. If the area of connective or cartilaginous tissue between the bones are compact, is called fusion or synarthrosis occurs. If the cavity forms between the bones as a result of resorption of the connective or cartilaginous tissue, it is called diarthrosis or synovial joint, which is mobile and has a synovial fluid and capsule. So synarthrosis is fixed in function, and it's also allowed the slight movement. If movement occurs in the synarthrosis, this kind of joint we call amphiarthrosis. For example, the amphiarthrosis are the interosseous membrane is divided synarthrosis which is immobile are the syndesmosis. When between bone we have the fibers of connective tissue, and synchondrosis when between bone we have cartilaginous tissue, and synostosis when bone fused with each other. For example, the kind of syndesmosis are the suture by which the bone of the skull connect with each other, and the suture which present between the skull bone remain up to the 20 years, and then syndesmosis performed to the synostosis and the bone fused with each other. Why we have suture between bone of the skull up to 20 years? Because the brain grows up to 20 years, and then at 20 years it stops to grow, and the bones fuse with each other. Next is the kind of synchondrosis. Synchondrosis it's a joint in which the bone tissue connect with each other by the cartilage, and the synchondrosis are the costal cartilages, and the costal cartilages of each rib, which is a true rib, connect with the manubrium and the body of sternum by the costal cartilage, and this kind of the joint it is synchondrosis. And for example, epiphyseal plate, which present between epiphysis and the diaphysis of the long tubular bone, and epiphysis give growth to the bone in long direction, and it's regrowth due to presence of this epiphyseal plate, and this epiphyseal plate, which formed by the hyaline cartilage, remain in the long tubular bone also up to 20 years. So according to the shape and function, the joints are classified as follows. The function of joint determined by the number of axes on which the movement occurs. So this classification of the synovial joint, which is the mobile. And the movements which possible in this joint take place in different kinds of axes. The uniaxial joint are the pivot joint, for example, proximal radial ulnar joint, and the hand joint, which is, for example, ankle joint. In which axis possible movement? In the proximal radial ulnar joint, which is a pivot joint, possible just movement along the vertical axis is supination and pronation. And the biaxial joint, the movement in the biaxial joint possible in two axes. For example, the biaxial joint are the ellipsoid joint, which is wrist joint, in which possible movement in two axes, in frontal flexion extension and in sagittal abduction. Condylar joint, for example, knee joint, saddle joint, it's carpometacarpal joint of the thumb. And the multiaxial joint, in which possible movement in all axes, The multi-axial joint are the ball and socket joint, for example, hip joint, and in this joint possible movement in 3 axes: in frontal flexion extending, in sagittal adduction abduction, and in vertical rotation. And plane joint, for example, acromioclavicular joint. And these pictures of this joint, and we can see the shape of the ball and socket joint, which, for example, shoulder joint. And this one is the pictures of the hand joint, for example, the humeral ulnar joint, and this one saddle joint, which is a carpometacarpal joint of the thumb. And this joint is the pivot joint, which is a proximal radial ulnar joint. This kind of joint is gliding or plane joint. It's present, for example, between carpal bones. And this one is the condylar joint, which present in the metacarpophalangeal joint. So, intervertebral joint. Intervertebral joint is joint between articular process, the plane synovial joint. Another name of this joint is zygapophyseal or intervertebral joint. And the joint between the vertebral bodies are symphysis. The surface of vertebral bodies are lined by the thin layer of hyaline cartilage. Between these layers of hyaline cartilage, there is a thick plate of fibrocartilage, which is called the intervertebral disc. The nucleus pulposus is the central part of disc, and the annulus fibrosus form the peripheral part of the disc. The ligament of this joint, between bodies, we have anterior longitudinal ligament on the anterior part from bodies, and the posterior longitudinal ligament on the posterior part of the vertebral bodies inside in the vertebral canal. Between processes, we have also several ligaments. Between transverse processes, we have intertransverse ligament. Between spinous processes, we have interspinous ligament, and with the tip of the spinous process attached the supraspinous ligament. And between lamine, it's ligamentum flavum. Next joint, Atlanto-occipital joint. In this joint, the occipital condyles articulate with the superior articular facet of atlas. The type of this joint, it is synovial condylar joint, and the ligament are the very wide ligament, and we call this ligament membrane. It's anterior Atlanto-occipital membrane and posterior Atlanto-occipital membrane. And the movement of this joint is flexion, extension, and lateral flexion. So these pictures of the intervertebral joint, and we can see the structures like intervertebral disc, which present between vertebral bodies, and this anterior longitudinal ligament, this posterior longitudinal ligament, this ligamentum flavum, this interspinous ligament, supraspinous ligament, and this one is the intervertebral or zygapophyseal joint, and type of this joint, it is synovial joint. And in this synovial joint we have capsule, we have the two articular processes which covered by the hyaline cartilages. Inside we have cavity which contain the synovial fluid. And these pictures of the Atlanto-occipital joint, and we can see the structures of this joint and the ligament of this joint. On this point we can see the anterior Atlanto-occipital membrane, and here we can see the posterior Atlanto-occipital membrane. And in the cervical region, the supraspinous ligament, which attached with the tip of the spinous process, become very thick and form ligamentum nuchae, which begin from 7 cervical vertebrae, from spinous process of 7 cervical vertebrae up to the external occipital protuberance. Next joint, Atlanto-axial joint. It's joint between first and second cervical vertebra. The type and articular surfaces. This joint, complicated joint, because it's formed by the two lateral Atlanto-axial joint, which present between inferior facet of atlas and superior facet of axis, and the type of this joint are the plane joint, and unpaired median Atlanto-axial joint, which present between dens and anterior arch of atlas and transverse ligament of atlas. And type of this joint, this is a synovial pivot joint, which give the rotatory movements. So it means the movement like this to right and to the left side. The ligament of this joint, we have several ligaments. The first ligament begins from the dens. apical ligament, alar ligament, and the cruciate ligament is formed by the transverse ligament of atlas and longitudinal bench of fibrous tissue. And all this ligament covered outside by the membrana tectoria, which is a continuation of the posterior longitudinal ligament. Next joint is joint between the ribs and the vertebral column, costovertebral joint. So in this joint, the head of the typical rib articulates with the oven vertebra and also with the body of the next higher vertebra. If you remember, on the body of each vertebra, we have costal facet, which is superior costal facet and inferior costal facet. And this articulation form the synovial plane joint. Which is separated by the interarticular ligamentum of the head of the rib. This ligament begins from the crest which present on the head of the rib and attached with the intervertebral disc. And outside from capsule we have the radiate ligamentum of the head of the rib, or radiate costovertebral ligament. Next joint, costotransversal joint. Articulation takes place between tubercle of the rib and transverse process of the corresponding thoracic vertebra. The capsular ligament are the costotransverse ligament. In the both joint, in the costovertebral and in costotransversal joint, possible movement in the act of breathing. Its elevation rib take place in the inspiration, and depression of rib take place in the expiration. Next joint is the sternocostal joint. It's joint between sternum and rib, and especially we have in the joint of the first rib and the second rib. So the cartilage of the first rib fused with the manubrium of sternum by the cartilage and forms synchondrosis. And the second to seventh rib articulate with the sternum and form the synovial sternocostal joint. Each joint has the radiate sternocostal ligament which present outside from capsule, and the joint of the second rib has interarticular sternocostal ligament because the second rib fused with the costal facet which present between manubrium and body of sternum. So the pictures, first pictures is the pictures of the Atlanto-axial joint, and we can see some ligament of this joint. Here we can see this one is a dense, this one is the alar ligament, this apical ligament, this one is the cruciate ligament, which formed by three structures: superior longitudinal bench, transverse ligament of atlas, and inferior longitudinal bench. The transverse ligament of atlas is passed behind this dense and attached with the lateral mass of atlas. And all this joint covered outside by the tectorial membrane, which is the continuation of posterior longitudinal ligament which present on the inside in the vertebral canal. These pictures of the costovertebral joint, and the head of rib articulate with two costal facets, this superior costal facet and this inferior costal facet. And here we can see the ligament which is the interarticular ligament of the head of the rib, and this one radiate costovertebral ligament. And this one, for example, in this picture we can see the costotransversal ligament, which is ligament of the costotransversal joint which present between the tubercle of rib and transverse process of thoracic vertebra. And this one is the sternocostal joint. So the first rib fused with the sternum by the synchondrosis, and the second from second to seventh rib articulate with the sternum by the synovial sternocostal joint. And here we can see the ligament which present on the second rib, which is an interarticular sternocostal ligament, and outside from capsule we have radiate sternocostal ligament. So this joint of the vertebral column, sternum and rib, and next joint of the upper limb, and the first joint, sternoclavicular joint. Sternoclavicular joint articulation, sternal end of clavicle and clavicular notch of sternum. And in this joint present articular disc. This joint is a synovial double plane joint, and the ligament of this joint anterior sternoclavicular ligament, posterior sternoclavicular ligament, interclavicular ligament, and the costoclavicular ligament, which begin from first rib to impression of costoclavicular ligament. The movements are the forward, backward, elevation, and depression of the upper limb. Next joint, acromioclavicular. So these pictures of this joint. So this one, and we can see the articular disc, which present inside in the cavity of the sternoclavicular joint. This interclavicular ligament, which present above jugular notch. This one is the anterior sternoclavicular ligament, and this one is the costoclavicular ligament. Next joint, acromioclavicular joint. Articulation, the acromion of the scapula and acromion end of the clavicle articulate with each other. In the 30% of cases present articular disc. The type of joint, this is the synovial plane joint. The ligament are the superior acromioclavicular ligament, inferior acromioclavicular ligament, and corococlavicular ligament, which extend from the coracoid process and attach with the trapezoid line of clavicle to form the trapezoid ligament, and also with the conoid tubercle forming the conoid ligament. The movement are the gliding movement. This joint. This acromioclavicular joint, and this one is the corococlavicular ligament. We divide it in two halves. This is the conoid ligament, and this one is the trapezoid ligament. Next joint is the shoulder joint. So shoulder joint articulation, the head of the humerus and articulate with the glenoid cavity of scapula. The glenoid cavity supplement around by the fibrocartilaginous rim, which we call glenoid labrum, and the glenoid labrum surround the head of the humerus up to the anatomical neck. Type of joint, it is synovial ball and socket joint, and the ligament of this joint are the glenohumeral ligament. We have three glenohumeral ligament: anterior, posterior, and medial. Then transverse humeral ligament, which form the bridge between the two tuberosities, and behind transverse humeral ligament pass the tendon of biceps femoris muscle and surrounded by the synovial sheath, and the coracohumeral ligament, which begin from coracoid process to the humerus. And the accessory ligament of this joint is the coracoacromial ligament. The movement of this joint: flexion, extension, adduction, abduction, and rotation. So this one is the shoulder joint, and this one is the head of the humerus, and this one is the glenoid cavity. This one is the glenoid labrum, and the ligament we can see here. This one glenohumeral ligament, which is a capsular ligament. This coracohumeral ligament, and this coracoacromial ligament. And this one is the transverse humeral ligament, which is hold the tendon of biceps femoris muscle, which is surrounded by the synovial sheath. Then we have elbow joint. Elbow joint is complicated joint because three bones articulate with each other: humerus, radius, and ulna. And these three bones actually form the three joint: the humera ulnar, humera radial, and proxima radial ulnar joint. The humera ulnar joint articulation: trochlea of humerus articulate with the trochlear notch of ulna. Type of joint: synovial hand joint. Humera radial joint. In this joint, the head of the radius articulate with the capitulum of humerus, and type of joint: synovial ball and socket joint. And the proximal radial ulnar joint. In this joint, the head of the radius articulate with the radial notch of ulna, and we have here annular ligament of radius. Type of joint: this is a synovial pivot joint. And the ligament of this joint: radial collateral ligament, ulnar collateral ligament, annular ligament of the radius, and also small quadrate ligament, which present between neck of the radius and ulna. The movement of this joint is flexion, extension, pronation, and supination. So this joint, this radial collateral ligament, ulnar collateral ligament, this annular ligament of the radius.